So which people should be tested, and how do we decide who of the people that we are screening and triaging should be tested? The first and most important thing is that only people who meet the case definition for contact and potential COVID case in South Africa should be tested. This can be found on the NICD's website, and please remember that the case definition is a fluid and liquid thing and is going to change depending on the epidemiology in our country. So please do check the case definition on a regular basis to see whether it has changed. The case definition means that, first of all, the person needs to be symptomatic with any kind of acute respiratory illness symptoms. Only one is necessary. That could be a cough, a sore throat, shortness of breath, or fever. Although we say that most patients with COVID present with or have fever, this is often not on presentation. At least half of patients on presentation may not have a fever. So any respiratory tract symptom is the first criteria. And then in addition to that, you need to have one of the following other symptoms or criteria. So either within the last 14 days, your patient was in close contact with a confirmed or probable case of COVID-19, had a history of travel to an area with local transmission or to a high-risk area, and you can find the areas on the WHO and the NICD website, or your patient either worked in or attended a healthcare facility where patients with COVID-19 infection were being treated, or the patient is being admitted to ICU or high care with a severe pneumonia and you don't know the etiology. If your patient presents with any of those symptoms, this is somebody who needs to be tested for COVID. Asymptomatic people should not be tested.